Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Well, John, let's talk about the 4Bs today. Build Back Better Billionaire, or Build Back Better Bill, as Congress is calling it.
I think this is kind of real infrastructure, David, not that fakey-like infrastructure that you're so in favor of. This is a very important bill, and I think the politics has kind of crowded out the substance.
Could be, John. I think there's actually a separate infrastructure bill. To me, this is a health and healthcare bill.
Details. No, but this is, if you think about what we're trying to, for the last 30 plus years, and I think that the president and the Democrats have lost the narrative. We have been trying to slim our way to success by cutting taxes on rich people, cutting taxes for corporations, and failing to invest in not just crumbling school and road infrastructure, which the other infrastructure bill is talking about, but in terms of medical school and keeping kids fed and child care and elderly care. I mean, I think this is the social side of infrastructure, which is really crucially important to invest in as we kind of emerge into this next phase of post-pandemic and the new America. I'm very excited about it. Again, there's a lot of horse race politics, well, who's up, who's down kind of conversation. But if you look at the substance of this bill, there's a lot to love in your Build Back Better plan.
John, I think maybe the Biden White House should hire you as a spokesman because they haven't done a great job of communicating it. Neither has leaders in Congress. Barack Obama was given a lot of criticism because he didn't sell the value of the Affordable Care Act as well as he could have. And that's true, and of the stimulus. But I think they're doing a much worse job right now. John, to me, this is a health and a healthcare bill with a dose of climate awareness built into it. We talk about social determinants of health, John, your favorite. How do you pronounce that?
Stop. I hate that phrase. I mean, let's start with let's unpack that, David. Social determinants of the health, a phrase that only an economist could love, is that those components of life and circumstance that actually are one of the most influenceable aspects of whether you're going to die healthy and old or unhealthy and young. I mean, it's things like food, housing, very basics, violence in your neighborhood. And, for me, they're not the social determinants of health. That's some fancy Harvard economist that is probably a friend of yours probably invented that phrase. It's really the determinants of health that we can influence if we could create the right kind of social circumstances for all Americans that allow them to live a healthy life.
John, it's funny to talk about this social determinants of health, which is like socialism misnomer, and then social distancing. What is that as well? So maybe we should get all the socialism out of this bill and recognize that, John, to your points, this bill actually does things like providing preschool, universal preschool and childcare, school lunches, affordable housing. And there's also a generational element of this, John. There's been a big tilt over the decades toward spending a lot of money on the old, especially from Medicare and Social Security, and not a whole heck of a lot on the young, which is actually where all the action and potential lies.
You're getting close, David, to that category where you too will be fighting for your hearing aid. I think that's right, though. I mean, I think that but this bill, and honestly, one of the challenges of communicating it is there's so much in it. But let's take one particular thing. There's something, again, the gruesomely titled Earned Income Tax Credit. This is a policy that would basically gives tax protection and financial support to those who are poor who have kids. By increasing the size of it, which we did by doubling the size of it during COVID and increasing the number of people who qualify for it, we literally cut child poverty in half. When you don't have hungry kids, they thrive more frequently at schools, their IQ gets up, violence in neighborhood goes down, and truancy goes down as well. It is a fundamental aspect of creating health and opportunity for poor kids, and this literally doubles the impact of it right out of the gate. I mean, and that's just one element in there. There's also an expansion of support for the school lunch program. Let's just stay on hunger for a moment. In many poor neighborhoods, a warm and a nutritious lunch is often the best meal for poor kids in the day. There's actually a desire to extend that through the summer, because without that, kids become less secure in their nutrition. Just that one small component of this really long, complicated bill could dramatically change the arc of whether kids grow up healthy and productive or not. And there's a lot more. But we didn't forget your category, Dave. There's some support in there for Medicare hearing aids, and there's support for actually decreasing the cost of drugs with the reversal of the rebate rule. So don't think you and the other grannies and gramps have been abandoned.
Well, John, you were good. You're getting a little soft on me there when you were saying a warm lunch. I think you're going to say warm and fuzzy lunch, which you could eat that, and I'll leave that one aside. You can have seconds, but and this earned income tax credit is an interesting one, because it's a negative income tax, but we don't like to say that a word around here. So earned income tax credit is a better one. And it's a direct way to make payments to lower income people. It makes a lot of sense. But John, you know what? Before you get all excited about this, whatever rebate rule you're talking about, Mr. Drug Man, what happened to the drug price negotiation? Are you always on your high horse about that? That's not in the bill.
The Democrats rolled over and are having their tummy stroked by the big pharma lobbyist who poured money. I think they've got a $6 million PR campaign scaring people about drug innovation, that if we could, in the US, actually get to the point where we could negotiate the extortionate prices that drug companies jack up on a regular basis, that we may lose the opportunity to innovate in drugs. I mean, let's get real. Other countries negotiate drug prices, and they have big, large companies like Roche and AstraZeneca. Oh, and by the way, a lot of these drug companies hide their intellectual property in Ireland so that they pay an even lower tax, while they refuse, in Ireland of all places, while they refuse to negotiate fair prices. This rebate rule was a phony a distraction from the fact that they overcharge American consumers, and that's why 1 out of 4 consumers who are on chronic meds can't afford their meds. The big pharma lobbyists came in here and bought off enough Democrats that they can't get it in the bill. I mean, 83% of Americans agree that the United States should negotiate drug prices. Private sector executives like Florida Blue CEO Pat Garrity believe in it. It's the people in the know better. But unfortunately, pharma dollars go a long way.
Well, John, talk about return on investment. You can't really fault them for that. I think the drug industry has to be pretty pleased with this bill. The other thing that's not in there that I think nobody was going to put in there really is about immigration. We're talking about having a shortage of workers, not enough people to care for the elderly, not enough people to pay for Medicare. Immigration is a logical opportunity, and unfortunately, I think it's one of those places where made it so scary for Democrats to talk about it that nobody's really talking about immigration in a positive way, which is too bad, because that's really what makes the difference of America with a strong and growing economy over the decades compared to other countries.
Well, you do have a little bit of support for dreamers, those who are born to folks who do not have a legal immigration status, but who have grown up here as U.S. born young people. You do have some in investments in healthcare, which I think are going to put even more pressure to actually find nurses, because there's a real nursing shortage because of the crimp in skilled immigration that the Trump administration created. And we're going to have a real challenge at staffing many of the jobs we need unless we support a more balanced immigration policy. And it's, but I think we're going to have to come back on that one. That is a big red flag cause for the Republicans. And I think the Democrats are smart enough to avoid that one.
So, John, I think we're talking about what's not in there and having to do with drug price negotiation, with immigration, but there is something that it really is fundamental and it really just has a gigantic impact potentially, and that is climate change. And that the Democrats have been wise to keep in there and to make it pretty big. And in fact, the amount of greenhouse gas emissions that they say it will reduce is, get this, 1 gigaton. That sounds like a lot.
Well, I think that this is a down payment. I mean, unfortunately, because the politics have become so tricky on this issue, the Democrats have a diverse party. The Republicans have an anti-constitutional single Trump party. I don't know quite there's no real way to describe it ideologically. That's distracted from the fact that this will be the biggest one-time investment in, again, a foundational investment in setting the United States up to generate more green jobs and to lower our carbon footprint. I mean, you look at the multitude of things we're doing here. It's to create incentives around domestic supply chains and solar, wind, and other industries. It's sort of the reverse of a carbon tax. It's actually creating sort of an anti-carbon subsidies that'll actually, it's kind of mirroring what China did, which is to subsidize the jobs and the businesses that can accelerate our ability to kind of support a greener future. And I think in some ways the complexity of this bill is distracting from the substance of its impact, whether it's keeping more kids, fed, foundationally investing in those green jobs, and actually also a pretty substantial set of investments in healthcare infrastructure, subsidies and support for medical education, public health infrastructure, and an emergency response in the time of a pandemic. I mean, it's a pretty interesting set of initiatives, and it looks like they've got the majority of the Democrats almost there, David.
Well, it's going to take every single one of them, I'm afraid. So it's hard to talk about gigatons and trillions and billions, but when we get down to the hundreds of thousands, it's something we can understand better. So when you talked about the Civilian Climate Corps, that's supposed to be about 300,000. That's, fills roughly 3 very big football stadiums. And then on home care, which we haven't talked about and which is addressed in this bill, they talk about a waiting list of 800,000 people, a waiting list for home care for Medicaid, and how this is going to clear that waiting list and have better quality jobs for those that are doing the caregiving. Do you buy into that, John, as a home care man, which you are?
You do have a problem not just of supply of talent, but of payment. And because this bill, as it stands, if it passes, it'll actually start to pay in the Medicaid agreement. That's the government's program for the poor, fairer wages to people who do some of the toughest work, the going to people's homes and helping keep them healthy. And if we don't do that, again, they're going to end up in the hospital or the nursing home and cost us far more money.
So last question, John, do you think that this bill represents a turning point for the Affordable Care Act, Obamacare?
The turning point for Obamacare was that support for it actually grew during the Trump years when the Republicans were taking their last shots at taking it up. Right now, Obamacare is called the American healthcare system. It's got majority support in almost every state. There has been broad expansion of the Obamacare extensions in terms of the Medicaid in red states. Whenever it's been put on the ballot, it's won. I think there's some support and some trimming to help it here, but as a practical matter, Obamacare is the law of the land and will stay that way. This benefit, I think, is a forever benefit, David. It's all, and we can make some tweaks here and there, but it's a foundational step in increasing coverage, and it's worked, and it will continue to grow.
Well, John, I started off this podcast talking about the Building Back Better for Billionaires bill, and they didn't put a billionaire tax in it, and it's just as well, because I don't know if it's going to affect you one way or the other. It just might, but now it's either we won't get to find out if you're going to be a billionaire during this 10 years or not.
Not me, man. You're from that rich neighborhood. I live in the city of Stanford. No, I look, the tax kerfuffle, but there's some good tax provisions here as well. A 15% minimum corporate tax and a global agreement on that. That's a big win. Starting to incrementally add more surtaxes and taxes on millionaires and billionaires. They didn't get everything they wanted, but gosh, there's a lot to like in this bill.
Sounds good, Jen. Well, we'll keep our eyes on it and see where it goes. That's it for another episode of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening, and please subscribe.